My name is Dr. Nizar Kifaya. I'm the President and CEO of Hudson Regional Hospital. At our hospital, we've adopted a patient-first philosophy. We're committed to providing all of the necessary resources that a great community hospital should have to take care of its people. We've been able to recruit some of the top talent, surgeons and physicians from New York City as well as New Jersey. There's no reason for the residents of Secaucus and Northern New Jersey to travel to New York City anymore. We're a technology-driven hospital. We believe that using cutting-edge medical technology can help excellent physicians produce even better results. We've invested in Da Vinci technology, which is a robotic technology that provides the physicians with the ability to provide minimally invasive surgery for patients, which results in better outcome and faster recovery and return to work and home environment. At Hudson Regional Hospital, we're building a healthier community.
Hudson Regional Hospital is at the top of its game. The hospital has been very forward-thinking in terms of its approach towards surgeons and approach towards technology. The patients being subjected to a less invasive procedure, which will translate into better outcomes, and I think we're seeing that now.
Back in 2003, I was working and I had a high-impact injury. Actually, the lower discs collapsed in my back. I've tried everything from therapies, I've gone to chiropractors, I've gone to countless injections. You name it, I've tried it. I went to see Dr. Lewin and he suggested the robotic surgery to me.
Part of the surgery is the placement of spinal screws. And so there's not a tremendous amount of room for error. What the robot is capable of doing cannot even be paralleled by human hands. The way we look at it is it's akin to landing a plane. There's a technology assistance that can, in conjunction with the pilot, aid for a successful takeoff and landing. It enables us to put our best foot forward using all the skills that we've been trained to safely and more accurately guide the placement of those spinal screws.
Over the years, I've gone to countless orthopedic surgeons, and they've all told me that there's no guarantee that the procedure is going to work. Dr. Lewin, when I spoke with him, he says, that's insanity. He says, the procedure is going to work.
There are very few hospitals in the state that have a Mazor, and there are very few that have a Da Vinci. So together, we can develop robotic platforms and see shorter hospital stays and better outcomes, which translates into quicker recoveries, getting back in the game that much sooner.
It's been almost 6 weeks since the surgery. My progress has been incredible because I don't feel any pain. I was at zero pain. I haven't been able to say that in about 40 years.
If we put quality first, the surgery that potentially used to take 3 hours may enable a surgeon to do it in 2 hours with less blood loss, better post-op recovery.
First few nights I was in the hospital, I was in the ICU. I can't say enough about the staff. Anything I needed, they were there. If I hit that buzzer, within seconds they were at my room. They were just great.
A personalized approach towards everyone's care, and I think we're going to be seeing great things coming out of Hudson Regional.
Didn't matter how big, how small the hospital was, I had all the confidence in the world in Dr. Lewin.
It's very exciting for the hospital to be at that level of cutting edge and to be able to bring that to the local community and beyond.
What's really nice to know is that I could live my life now without any pain meds. I'm thrilled. Deciding on Hudson Regional Hospital was the best decision I made in my life. There's nobody better.
I'm the director of female pelvic reconstruction and robotic surgery here at Hudson Regional Hospital. 10 years ago, I started doing robotic surgery. As one of the pioneers in the field, I completed approximately 1,000 major robotic cases. In North Jersey, we really don't have great options for robotic surgery. Still, the majority of cases are still done in an open, traditional approach, unfortunately. Here at Hudson Regional, we do have the most complex surgical system in the world. There's nothing more complex than the Da Vinci Xi system that we obtained just recently. We have a great opportunity of really providing the community, providing the highest level of technology, the most up-to-date, surgical modalities. With great confidence, I can tell you that robotic surgery is a safer approach than open surgery. The fact that you can do all these complex cases with great meticulous, specificity, small movements that otherwise with bare hands you cannot do. I always tell my patients that you could literally peel off a grape without touching the inside of the grape with a robot, and you cannot do that with your bare hands. Minimal incisions, minimal scarring for the patient. Oftentimes, same-day surgery, even for the most complex cases, patients go home the same day. When compared to the old traditional approach, the open approach, where a patient will stay in a hospital for 4 or 5 days. Another great benefit of utilizing robotic surgery is the post-operative pain, which is minimal and significantly reduced as compared to open traditional cases. The outcome is much better, in my opinion, simply because, once again, less blood loss and quicker recovery. Smaller abdominal incisions, we are talking about 3 or 4 8mm incisions, which are the size of an M&M. Patients will come to this hospital and receive a very personalized and very one-on-one care with really a first-class team. From the support team to the nursing staff to the surgeons operating, we are providing care at the same level as any great medical institution in this country, and oftentimes better.
This hospital, not Hudson Regional, but as it was prior, didn't have the strongest reputation in the community, and I've experienced personally face-to-face with patients some hesitations about coming here.
I'm excited about the new changes that are happening at Hudson Regional. They're bringing in a lot of new doctors, a lot of new nurses. It's changing the atmosphere a lot.
I think that this hospital is really the best place for you to come when you're in an emergency. One, because of the location and how quick it is to get here. Two, because of the level of care that you're going to get. Here you'll have access to an EMS team who genuinely cares about you, not just as another insurance card, but as a person.
This person needs to live, needs to go back home with their families. They're lives are just as important, so I want to treat them like family and be there with them.
It's not a regular 9 to 5. We get a call. As soon as the call adjusts, where we find out where we're going, we're on the go.
We're there with you through every step of the way.
That close relationship is what differentiates us from other hospitals in the area. You're not just a number here. You're a person with a story, a person with needs that need to be addressed.
I'm an orthopedic surgeon with a specialty in sports medicine. In the past, I have treated from high-level athletes, professional athletes, to high school athletes to weekend warriors. I'm very pleased to be appointed as the Chief of Orthopedics at the new Hudson Regional Hospital. I'm very grateful for the opportunity and truly dedicated to turning this hospital into a center for orthopedic excellence. Being the Chief of Orthopedics, what I'm really excited about, recruiting top talent, top surgeons, whether locally or from New York City, so patients don't have to travel 45 minutes to either New York City or neighboring towns. That high quality of care will be provided at their doorsteps within Hudson Regional Hospital. I specialize in minimally invasive procedures. We're able to do complex surgery, just what arthroscopic means, which means greater outcome from our patients, and also they get back to the game sooner. We're doing same-day joint replacements here. We have access to robotic-assisted joint replacement. We have invested a lot into new technology, which allows me to perform complex shoulder, knee, or hip surgery with minimally invasive approach, meaning very small incision, great outcomes for our patient, and more importantly, faster recovery. The majority of the procedures are done same day. Patients come in and they're able to go home within a few hours. What's so unique about Hudson Regional Hospital is the quality of care that you're getting. The nursing staff, the OR staff, they all care about you. They know you by the name, and you're not just a bed with a number. What I'm really impressed by is how committed the new management is to this institution. So far, in a short period of time, a lot has changed. They have truly invested into the infrastructure, to technology for the hospital. I truly feel confident to bring my own family member in an event of emergency, and I think the community will feel the same.
Here in Hudson Regional Hospital in the labor and delivery unit, we are very warm and welcoming. The mother comes in and she's nervous, she's scared, she's excited, she doesn't know what to expect. And when she meets our staff in labor and delivery, she's always much more at ease. We're able to provide a better health care for the patients because we're a smaller facility, and we're able to give that one-on-one direct care to the patients.
We have certified nurses. That means that nurses are certified within their specialty. So we have labor and delivery nurses, postpartum nurses, nursery and pediatric nurses. Our rooms are private. They overlook the Hackensack River. They're specialized and they're beautiful, our rooms. We try to make it a very intimate setting, and the family could spend their time in a comfortable area.
When you're delivering, you really want privacy. You want to know that you're safe and that your family can be with you and not have any concerns with other family members or other people that you're not aware of. This is something very intimate, something that you want to share with your family, but also keep in your family. It's great because in larger facilities, they're not able to offer private rooms for their patients because of the volume they have. One of the benefits we have here, we go above and beyond by offering our patients a candlelight dinner where they can pick gourmet meals and sit down and have one last night together before going home with their baby.
We pride ourselves in family-centered maternity care, and we offer childbirth education to help the mom learn about the process of labor and delivery and what her expectations would be.
We prepare them for before and after care. So upon delivery, you go home knowing I can go home and take care of my baby.
After the mom goes home, she's more educated in taking care of the baby as well as the father. And that's why family-centered maternity care and this model is beneficial for the mom, especially when she goes home.
We follow up with our patients. Upon discharge, we give them a week or two and we follow up with them. How's breastfeeding? Do you need anything? Did you get all your discharge papers? Do you need anything for insurance purposes? We are going to take care of them and do the best job possible so they can have a great experience. At Hudson Regional Hospital, we promise to treat your baby like our own.
I started having a weird sensation in my abdomen. I looked as if I was filled with helium. You know, my stomach was very distended, and I decided I couldn't stay home any longer. I'm gonna stay locally and go with Hudson Regional. I can honestly say that was the best choice that I've ever made. I didn't realize how serious it was until days later, maybe 3-4 hours in to my stay in the emergency room. I was told I was almost set up for surgery, and I'm like, surgery? I said, listen, I don't think I need to go to surgery. He sat me down, he said, hey, listen, you know, you're in a bad situation right now, and had you stayed home another day, you wouldn't have made it. You would have died at home. Right now, your small intestine has gone inside your large intestine, which is cutting off blood supply throughout your digestive system. You have a lot of things going on in your abdomen, and we need to set you up for an emergency surgery. This was my first surgery. I never gone under the knife or anything of this magnitude. He said, hey, listen, don't worry. I'll take care of you. You'll be fine. It was an emotional time for me, just realizing how close I came to death. I really commend the staff there at Hudson Regional. Everyone there was so accommodating. You know, if I wanted to get up and I felt the need to walk, it didn't matter what time of day or night. You know, I mean, I've had the ICU staff walk me around at 1, 2 o'clock in the morning. I requested a larger room. I said, hey, listen, whatever it is, we're willing to accommodate you to make your stay as comfortable as possible. So they were there for me. They helped me to be independent, get myself back on track. You know, you have to commend the hospital for picking such a wonderful staff and help to just make it home. And they did that for me, and I'm truly grateful. As far as my surgeon alone, he's awesome. He was just my lifesaver right there, you know? My extra life. He comes in, he gives it to you straight. He say, hey, listen, this is what the situation is. This is the surgery that you're going to go through. There's no gray area with him, which is great, you know? And everything that he said was factual. You know, I went through everything just the way he gave it to me. And eventually I made it home. So I owe a great debt of gratitude to the staff there at Hudson Regional.
Two months ago, my mother moved from New Jersey to Florida. I was lifting boxes, packing boxes, and I was in pain. By far, the worst that my back has ever been. When I said to my wife, I said, it's time to go to the emergency room. I called Dr. Lewin, and he said, meet me at Hudson Regional Hospital. I barely crawled in. I just bent over in such pain. He saw the MRI, and he decided that I was going to have the surgery that very day. It's so unusual to go from the emergency room into the operating room in the same day. That probably would never have happened at one of the larger hospitals. After the surgery, Dr. Lewin explained what he found when he was inside and able to see. There was an osteophyte, which is a bone spur, which he rectified with a laminectomy. And then he found underneath that there was a cyst, which he had to remove. At the bottom level, there was a bulging disc, and he was able to conclude all procedures that were necessary. As soon as I woke up, the decompression felt successful, and I was not in pain at all. But Dr. Lewin was explaining to me how they do this minimally invasive procedures. It was just, I think, maybe a 1/2 inch, 3/4 of an inch incision. they're able to do this procedure without tearing through the muscles. They just parted the muscles, basically. It's incredible. The minimally invasive procedure minimized the recovery. It's 6 weeks and I'm able to function fairly normally. From top to bottom, the nurses who were in surgery, the anesthesiologists, the cardiologists, they were all wonderful. I connected with them as people, and I'm just so thankful for that. I didn't know about the facility at Hudson Regional. It's a facility that I can recommend. We have high-level equipment, technology, surgeons that you would expect that you could only get in Manhattan, but here it is in northern New Jersey. It's such a resource for the community.